Hello all, good morning. It's Paul Hober here again. I'm just wondering what it is that makes you think I'm going to suggest shockwave to this patient. It's an interesting point. When do you decide, okay, this person is right for shockwave? And it's a question I get asked a lot because we're taught early on in the literature that it should be someone who has a chronic, probably tendinopathy. So over 3 months they've been suffering with this problem, maybe a bit of ultrasound imaging proving it's chronic, and that's where a lot of the guidelines are suggesting this is where you should treat. But we know we're moving more and more into acute medicine. We know that we've got this stimulation with focused shockwave stimulation and differentiation of the stem cells. So who's to say that we're not getting a benefit for our patient earlier on? And I think the science is starting to catch up on this. So how do you decide whether you offer shockwave to your patient? It's a really, really interesting point, and I'm really keen to hear your views. But from my perspective, it's about offering shockwave as part of a treatment plan. You're giving the patient the education and understanding about what shockwave might do for them and letting them take part in the discussion. And we call that concordance. Concordance is when I have an opportunity to introduce you to various different opportunities for your care. You have a growing understanding of what each of those things would do, the good aspects and the negative aspects potentially of treatments. And therefore we have a discussion and we reach shared decision making, concordance. And I think that we have almost an ethical responsibility to make sure that we're offering everything, regardless of the cost of it, or whether we've made a decision about whether we think that person can afford each treatment or not. All of that goes out the window. I think what you do is you educate, you go for shared decision making, and at that juncture or somewhere in that melee of information, you're outlining what the costs are. But I prefer people to make informed decisions without really, being bogged down in whether the insurance is paying for this or they're paying for it. Get to a point where the person understands what it is, because it's then their decision whether they decide to fund it or not. And what you're doing is not being that unethical being that says, oh, I'm not going to mention this to this person because they've just told me that they're out of work or they're struggling or whatever it is. I'm going to make sure that I'm being equitable across all my patients and make sure that if this is a valid treatment option for them, because of your clinical reasoning, because of what they said, because of your testing, because of the diagnosis, then I think you offer it out. And in the same manner that you would do to anybody. So be it someone who has outlined to you that they don't have very much money, or someone who's walked in screaming billionaire, I don't think it should be different. This is not about money, this is about the best possible care. And actually, what you realise is people will make those decisions for themselves. Now, this isn't to put them in an uncomfortable position, this is simply to be equitable, because we cannot be so arrogant as to decide what the person can or cannot afford. We have to make a decision based upon what our prices are and what we think is best for that patient. And I think if you get to that shared decision making, everybody feels respected in the conversation, and everyone therefore is at the right level of education about each person. And this line is, whatever you choose to do will be the right decision, and I will work really, really hard to get you the result that you're after. And I think that just covers everything. Irrespective of what you decide, I'm a healthcare professional and I'm going to work tirelessly to make sure we get the result. But yes, we've got things over here and we've got things over there that we can use. You're educated now, you make the decision. That is the way to treat everybody like an adult. It takes away all of those ethical time bombs in your head, and all you're doing is giving everyone the same opportunity and then letting them be part of the discussion, and ultimately together you decide what you're going to do. Hope that's helpful.